talking about a very serious topic within the trans community. It actually is really serious. I don't know why I introed it like that, but I'm talking about transphobic medical professionals. So if you are trans, you have had experiences with this probably. If you are not trans and are wondering what this video is about, you are going to learn about how inappropriate medical professionals are towards us. And if you are not trans and don't know about these experiences, I want you to keep an open mind. Yes, some of the questions that these doctors ask, they need to ask it, but you need to understand it is the tone and the curiosity vibe that you get from the doctor that is inappropriate. So let's wheel it back because this is confusing for everybody right now. So the reason why I'm making this video is because I have had very horrible experiences with doctors, and I'm just gonna doctors and nurses at this point in my transition. Before transition, I mean, we all have weird experiences because people are rude, but this is different. It's on a different level because we are trans and because these doctors and nurses know our trans status and treat us differently based on whatever reason we're at the hospital or clinic for. So the first experience that I'm going to talk about is 5 years ago. I had a very horrible bladder infection because I refused to use public bathrooms, and I held in my pee for a very, very, very long time, as in like all day, because I was too scared to use the bathroom because blah blah, that old story. So because of this, I developed a very bad bladder infection which left me to be catheterized for 2 months. And that wasn't one catheter, it was multiple, and it hurt a lot. Anyways, I don't even want to go into that. It's very, very traumatic. But the first time that I went in there, I had 3 nurses and doctors all around me asking me all these really, really inappropriate questions. At this time, I was about 7 months on T. And I was kind of in that androgynous, like, are you male? And then they would look at my documents and be like, oh, okay. But I had some like, facial hair. It was very confusing for everybody, honestly. Anyways, the issues that I had were, the nurses would ask me very inappropriate questions about like bottom surgery. Now I understand if you're gonna catheterize me, you need to know if I've had bottom surgery. But if you look at my file, I had specifically said I have not had bottom surgery, which they were reading literally right in front of them. And it's just the angle and the way that they ask. It's like, so like, have you had bottom surgery? And it's not like, all right, so do you have any surgeries that you need to report or anything like that? Like, it was just very inappropriate, and I felt very violated in my own privacy. Even though it was necessary to know, there was a different way to ask. And this is probably my favorite one. Somebody in my file, because I went to the hospital 7 times within that 2 months because I had so many issues and complications. Somebody in my file wrote that I was MTF. So a doctor comes in and says, so do you still have your penis? I'm sorry? What? Can you just like back it up for 1 second? Can you imagine if I was a trans woman and somebody asked me, do you still have your penis? Excuse me? There is a much, much better way to actually ask that question. I can't even go into like a full-blown analysis and like discussion about how inappropriate that is, because I'm gonna leave that one to you because I'm sure you can. It's rude, whatever. I don't even wanna, it's traumatic, honestly. That entire experience is horrible. Fast forward to a couple of years. I don't wanna go through every single experience right now, but I had a psychiatrist who was very inappropriate to me, and I told her that I was having issues, trans-related issues, and she said, well, I don't deal with that. So she gave me like a referral to another clinic. Cool, I get it. You don't know how to handle maybe specific trans issues about bottom dysphoria or anything like that. And yes, bless her for referring me to the clinic because I really enjoyed being at that clinic. But no, I don't deal with that. Excuse me? What the fuck? Excuse me? I don't deal with that? Way to make me feel like a freak. Like, anyways, I was actually part of a news article and radio thing on this specific case because it was just like really ridiculous about these questions that these doctors were asking, and like that, I don't deal with that. And I'm not just being dramatic and saying it like, oh, that's not how she said it. That's literally how she said it. I don't deal with that. Me new. Look at me. What do you think? Me new is just like, please. Anyways, so these are my stories. There are more stories that I have, but those are probably the 2 of the worst ones. I have friends who have gone in for ear infections and they've literally asked, have you had have you had the surgery? And it's just like, maybe you need to know if I've had a surgery, but you definitely don't need to know what's in my pants if I have an ear infection. There's a lot more things. Anyways, the point is, it's very inappropriate, and I can understand how cis people who don't have this affect their lives can be like, but doctors need to ask those questions. Because I have had a conversation with somebody who is in med school who got so defensive about doctors asking these questions, like, no, they need to ask those questions. And like, I tried to be like, oh no, but you know, like, somebody's going in for an ear infection, you don't need to know their whole history of like, if they have bottom surgery and what their genitals look like, you didn't need to know. It's really just a curiosity thing. And that's where that's where the line is. The second it goes from like, oh, this is medically necessary to know in order for me to help you. This will benefit my knowledge of your body in order for me to help you heal and be a productive member of society. Okay. Then there's the line that's crossed where, oh, I kind of need to know this information, so, but I'm like really more curious about it, so like, have you had the surgery? Like, I don't understand the fascination about our genitals. I literally do not want you to tell me what your dick looks like or what your titties look like, or I don't even want to, whatever. Anyways, the point that I'm trying to make is that there is a line that is being crossed, and it is a violation of our privacy, and it is unfair because we are such a marginalized population that a lot of us don't speak up about these things. I don't speak up about these things. I would now, if anything happened to me now, I would be like, you have literally no right to know that. It did happen when I had top surgery. I asked the person, because I was having issues with, I was having muscle issues, and it was a new doctor, I had never seen her before, and she asked me if I've had the surgery, and I said, well, I had top surgery, and that's all we're focusing on right now, so that's all you need to know. But it's intimidating because doctors and nurses are people of authority, right? And it's very scary to have to not, like, call them out, but almost, yeah, because they hold the like key to your cure, and it's terrifying to be like, hey, you don't actually need to know those questions, and you're invading my privacy, and I don't feel comfortable at all. It's not fun to say that to somebody who's about to give you a prescription for, antidepressant meds or anti-anxiety meds or acne meds or anything like that you need in order to live your life. It's terrifying. I'm just saying, it's horrible, and I can't even explain the anxiety that comes with thinking about going to the doctor because of this. I have many friends who refuse to go to the doctor, especially clinics and hospitals, if they don't know that there is a doctor there that they can specifically see that has seen trans patients and is okay with trans patients and it respects trans people. Sometimes I'm scared. I go to the same clinic all the time because I know that they have my file and my information, and they've never ever been rude about me being trans or ever really asked questions about it. It's always been about like something else. Actually, one of the doctors came in from that specific clinic, which blessed, it's like literally maybe 30-second walk from my house. He comes in and he's like, all right, so what medication are you on? I'm like, oh, I'm on Delestrol, or that's when I was on injections or something, whatever. I was like, oh, I'm on testosterone. He's like, this young? Wow, have you had your thyroid checked? I'm like, your thyroid check? What are you taking testosterone for? I was like, oh, because I'm trans. He's like, oh, well, that's a good reason. That is a positive experience, okay? It wasn't bad. I like that. You need to know what medication I'm on. I'm not gonna like withhold, oh, I'm on testosterone. I'm not gonna hide that I'm trans from you, unless like if I'm going in there for an ear infection and whatever. Anyways, we've talked about this. But the point is that I am sometimes scared to go to the doctor because I don't want to deal with it. And this brings me to my next point, and this is probably one of the most important points, is sexual health education surrounding trans people. There is nothing. If you check online, yeah, maybe there's like a couple of resources. You'll hit a Google search, you'll maybe get 50 results. Not all of them are complete. Most of them are from trans people themselves, which is fine. I'm not saying that because you're not a doctor, you don't know all this information. But it would be very nice if there were pamphlets available at the clinic. Maybe specified at like LGBT health, and then there would actually be a trans section in there, and not just like oh, gay men are at higher risk of getting HIV, blah, blah. Oh, lesbians can also get HIV, blah, blah. And then where are the trans people? How about you talk about how trans people are dying in huge numbers because they're at risk of HIV and they're contracting. They're getting HIV at very high numbers that nobody is talking about, especially trans women of color. That's for another video. Oh my God, I'm going on a tangent right now, but I'm just saying sexual health is not talked about in this community and outside this community for this community. And this is a huge issue because if I think that I have an STI and I want to go to a doctor, holy shit. Even me being like so active in the community online and doing all of these things and like calling people out as much as I can about like, hey, you shouldn't be doing that, about like all these different things. Right now, thinking about even doing that gives me so much anxiety. If I thought that I had like chlamydia or anything like that and I needed to go to a doctor and they needed to like inspect me and it was a clinic, I couldn't get an appointment with my actual doctor at Concordia because like it takes like a month to get an appointment, but I need it now. The thought of that is just beyond stressful. And to have a stranger, even at the clinic that I go to that I'm okay with, I can't because we don't know and they don't know. A lot of doctors don't learn about trans health, and even though we know all about all these sexual transmitted infections and diseases and HIV transmission and all of these different things, for trans people, when we read these things, they're not targeted at us. So we, sometimes don't even think that it can affect us. I have seen posts in some of these trans groups where people literally are completely blind to the fact that they can get an STI. Even if they sleep with women, if they sleep with men, if they protected, people just have no idea because this sexual health stuff is not targeted at us. Well, this video turned into like a sexual health thing and a doctor thing, but whatever. This is where like the big issue lies, and I hate it, and we need more sensitivity training for doctors. So like even one class, take 1 hour out of the entire program that you're in just to have a trans person or somebody who's very knowledgeable about trans things, who is also a power of authority, because usually people listen to that more, and talk about, hey, so there are patients who are trans, and just because they're a very small percent of the population doesn't mean they don't need medical help. And the thing is that if you're nice to trans people, the word spreads within the community and you're gonna have more trans people come to your practice. It's ridiculous. I have seen so many posts online, even in Montreal, hey, I need, does anybody know of a doctor in the Montreal area who's okay with trans people, who is also knowledgeable about STIs in the community or anything like that? It's ridiculous. I see these posts all the time. Even in the FTM Montreal group, I see this all the time. I see this in the other FTM groups from all over the United States. I can't talk today. Yeah. One, we need more sexual health information for the trans community. And I know that there are resources out there, but people don't know about these resources. Maybe I should just make a sex ed for trans men video, because we are at risk, just like anybody else, of getting all of these things, and we need to be aware of them. And even if you use a packer, even if you use a what's the word I'm looking for? Oh my god, whatever. If you're using oh my god, I can't think of the word right now, but a peen to have sex with someone, Jesus, you are still at risk. There are so many things that people don't know about. There's things that I even don't know about that I should know about more. Although I think I'm pretty knowledgeable on some of these topics, so I'm trying to talk about them right now. We just need things that are targeted more at us. And I know that they exist. I'm very aware. I have seen these things that exist. But there are so many people who don't know that they exist. And we need people to know. Anyways. So the point of this video is that we need more sexual health information for trans people. We need doctors to have sensitivity training, and we need to be able to stick up for ourselves when something something happens inappropriately in a doctor's office, I guess, if it's safe to do so. And 4, if you are a cis person watching this, to please listen to your trans friends when they tell you there's a horrible doctor experience. Don't be like, well, they have to ask you those questions. No, obviously we're telling you for a reason, because there's trauma related to it. Just listen. listen, even if the doctor had to ask those questions, it could still be traumatic. Like, so if someone is very, very, very bottom dysphoric and the doctor asks him about bottom surgery and he has to answer that question because it's about, like, I don't know, getting a test or something like that down there, and he has to say no, it could still make him very dysphoric thinking about not having bottom surgery when he really wants bottom surgery. Yeah, so that's it. Yeah, anyways, more information, let's do that. Let me know what you think. Am I completely off base? What are your experiences if they're not too traumatic? Also, trigger warning, probably should have done that during the video because this is pretty traumatic for some people. But if you have any horrible doctor stories and you are okay to share them, or you think that they're funny or anything like that, please share them in the comments and we'll talk about that. And let me know what you think. All right, well, have a great week. Bye.